Welcome to Help! I Have Kids. I'm your host, Pam Marshall, a mom of 5 and a pediatric occupational therapist with over 35 years experience. This podcast is designed to equip you with practical tools, insights from experts, and real life stories. Because at the end of the day, you are the head of your child's care team. Each week, you'll hear from pediatric experts and fellow moms like you that will help build your confidence. They'll offer clarity and empower you to make informed decisions that work for your whole family. If you're a parent with a child with autism, chances are you've heard the word applied behavior analysis, or ABA. And some parents swear by it, but others are adamantly against it. It's such a hot topic, but we are going to talk about ABA today. And with my guest is Jill Moore. Hi, Jill.
Hi.
We're so glad you're here today. And Jill, you have been in a position to help lead and start our incredible ABA program that is different, and people are going to learn about it today.
Yeah.
So tell me about yourself. What prompted you to become a behavior analyst?
So I am a special education teacher, and I have been a special education teacher for 20 plus years. But it was time to kind of branch out and see what else I could do because I'd been in the classroom for so long. And ABA was just kind of coming around. It's been around for a long time, but nobody really knew about it.
Right.
And kids, my students were going to outside ABA therapy, and I was talking to parents and talking to my students' therapist. And I was like, this is super exciting. Like, I could do this. Like, I've been a teacher. I've mastered this. I've done this for a long time. This is another avenue that I could go into, and I could continue to help even more kids. So that's kind of my transition from being special education into ABA.
And what makes this approach at Marshall, like what we do at Marshall, how is it different than what you've seen?
So I really like what we had at Marshall. It was one of the reasons why I sought you all out, because a lot of ABA makes parents pick between school or therapy. And they don't get that choice of being able to do both. And as a teacher, school is very important to me. I see the value of school. I understand that, you know, you can have therapy to improve all these skills, but a child still has to have reading, writing, and math.
Yeah, they do.
So that forced choice of either you're going to have ABA and we're going to help on all these skills, but you have to say no to school. And that was a huge turnoff. And I could see families struggling with it. So what I really liked about Marshall is that it doesn't force you to pick. All of our kids in all of our location go to school.
Yeah, I love that too. And, you know, we're going to talk all throughout this episode, kind of even talk more about the program that Marshall offers and just learn more about ABA. But you as a person, let's get our listeners kind of knowing who's Jill, because I think you're kind of fun. You're kind of a fun person. You were just telling me about your costume you're going to put on with blue hair. So tell me a little bit about yourself and your family. And
so I have one son. He's 21. We went through the entire process. Even though I am a special education teacher, my son also needed special education going through school through to 8th grade. So that was another kind of growing experience for me when you do it on the professional side, but then you sit on the other side of the table.
Yeah, and you're a parent.
It also makes you really understand just that other side. It's a different perspective. It's a totally different perspective.
It gave you a unique perspective because you had both. You knew what it was like to be the professional helping and evaluating, and then now you're the parent receiving. And
So
advocating, you had to advocate as a mom for your child.
So he's doing great now. I said he's in college. He's doing great now. But that, so my husband and I, and just our one son, and I taught here in Fayette County for 21 years.
That's great.
Then I've been a BCBA for 4.
There you go. And you like to do little pranks around the office. You're a little fun that way.
The season. So
season of pranks.
It is. I have a cackling witch that I have been hiding in everyone's office at work. So it's motion censored. So when you open the door and they come to work in the morning, the witch cackles at them. It's been amazing.
Oh, I bet that's been fun. You're getting good reactions for sure. So let's go from the beginning. There's lots of people listening that maybe have never really heard, or they've heard of ABA, but they don't really know what it is. What is ABA?
So it's actually one of the questions that I always ask families when they come in for an eval, like, what do you know about it, ABA?
Yeah.
And most people don't. They assume that it's just going to address behaviors. And I always say, yes, ABA addresses behaviors, but ABA is also, and it has to be, communication skills, social skills, and adaptive life skills. And the purpose of ABA is that we have maladaptive behaviors. We have behaviors that we're not happy with. We're screaming, we're crying, we might have property destruction, all those maladaptive behaviors.
Or the child has these behaviors, right?
Yes. But to treat behavior, what you really do is increase communication skills. You increase social skills. You increase adaptive life skills. Because once you can communicate why you're upset, you don't have maladaptive behaviors. Once you understand how to ask someone to play with you, maladaptive behaviors just kind of fade away.
Yeah.
Once you understand, in order to get, I'm hungry. In order to get food, I need to go to the kitchen. I need to tell my mom. All of those things. And then those behaviors that have been negatively impacting your life, your child's life, they can almost subside just because we're increasing all of the other skills. So I always tell parents, yes, you're being referred to ABA by maybe your pediatrician or your school because you have behaviors of concern.
Yeah.
But ABA is going to increase communication, social skills, adaptive skills. And in that, we're going to target those behaviors, but because we're increasing our other skills.
Yeah.
And then those behaviors just they end up kind of helping diminish themselves just because we've increased our other areas and our other skill sets.
So the history of ABA that's what's a little controversial. And I think about, you were a teacher a long time, and I've been an OT for 35 years, and I remember some of the history. So let's talk about that a little bit, because I think if we're going to dive into ABA, the world of the controversial history of it, I remember as a young occupational therapist being in homes of children with autism, and maybe some homes hired a LOVAS trainer, and a LOVAS trainer was sent to California, and they were trained and they came back, and it was a lot of discrete trial training at the desk or at a small table and chair, a child-sized small table and chair. And I was a very sensory-based OT and understood how a child had a lot of sensory needs and needed, because I have sensory needs as a person.
We all do.
We all do. And just, it really broke my heart to see some of the interactions and some of the rigidity of, that type of treatment. So let's talk about the history and what you know and why, there are some people who are really, really against ABA.
So ABA originally was kind of done in universities or institutional type settings. So it was because
it was research. It was researching human behavior. Yeah.
So it was a research kind of setting, and one of those settings where somebody looked at you through like a two-way glass, and then they gave you feedback on how you did a specific something. Like you were doing an instructional practice, a corrective practice, and they were giving you feedback, and it had to be so precise, very rigid, but it's for research purposes. It isn't really real life, which is why it was done in laboratory type settings at universities and then in institutions.
Yeah.
We know that it works, but it was kind of pairing that work to, but in life, you can't do that. In life, I needed to work in my classroom. Like I need something that's going to work in my classroom. And in my classroom, I have 15 to 20 kids in a special education classroom, but I could have up to 30 kids in a general education setting. And a child needs to be with their peers. So what ABA started out as that research, that very, very structured, controlled setting, we knew couldn't translate out of those settings.
Right. And you needed your child that you were helping with special need that had a lot of behavior to be able to go into a classroom of 30 kids and not hit his peers or her peers. Or
he needed to not hit the peers, but he also needed to get the content.
Right. He needed to be able to learn.
And, so in the last, I want to say 15 to 20 years, but I could be wrong on that. We've had a lot of really good research that's kind of left the traditional, the Lovaas models, the original Awada models for ABA, and has gone into more assent-based, more play-based. And that is really where our field is going. Greg Hanley does a lot of that research and travels the country, travels really the world, but training people to kind of rethink ABA.
Right.
ABA should be assent-based, not controlled, not that DTT, although it has its moments. There are certain skills that works for.
Right.
But certain skills. And that it needs to be play-based and it needs to be natural. It needs to be with peers that are that child's same age. So a lot of the stories that people hear about ABA, especially when you talk to adults with autism that experienced ABA maybe in the 80s or 90s.
Or seen what I saw in my early years.
Yeah.
Which would have been late 80s, 90s.
They have a very different view of ABA because they saw that traditional model, and they're not seeing the model that is really where our field is going now.
Right.
Not that there aren't people that still do traditional ABA, but the field is moving more and more and more away from that. And I talked to a family once about it, and it was the same conversation that she had with me about special ed. And she was like, no, I saw the children that needed special education when I went to school. Okay, but that's not special ed now. Special education now is so different. Our children are in classes with 30 other kids. And
it's inclusion.
Yeah, it's, it's a fully collaborative model. I need you to think about ABA that way too.
Yeah.
Every discipline has its origin, but that discipline has grown. And ABA has grown, and so much more now. We are doing a focus model, a model that is allowing kids to split time so that they can go to school, they can get their academics, they can get their peers.
Let's talk about, like, if we have a parent listening who's maybe never observed ABA or is worried about, some people call it old ABA and new ABA, even though that's hard to describe it that way, but what is the difference if we were going to describe, like, maybe the older version of ABA, the more discrete trial? What would that look like versus what would it look like in a play-based?
So in a traditional model, typically everybody has a one-on-one RBT, a therapist, and they would have a table. And at that table, they would have a specific reinforcement schedule that their BCBA assigned. And they would sit there and they would do flashcards. And then
or the circle in the puzzle.
Oh, the circle in the puzzle.
Put the circle in.
But it's very much directed by that person. It's one-on-one. It's sitting at a table, and on the table would be a card. Like, you're going to reinforce him every 3 times, whatever the BCBA decided. That's the traditional model. And whether it's sorting or a flashcard, but then you do that for 15 to 20 minutes. Then you get to play for a minute. Then you go back and you do that for like 15 to 20 minutes. So it's very rigid. It's very structured. And then it repeats itself for kids that are like a full day. So they would have all of their programming in the morning. They would eat lunch, get a new therapist to come in the afternoon, and then just repeat it all again.
Okay. And then, so what does the play base, like what would that session look like now, or how would that interact? Like say the problem was the child has a lot of stimming. They may look at their hands and they need to do more functional play. So say that's your goal. What does it look like?
So in a play-based model, it's whatever the child leads that day. So if I have a kiddo that comes in and their favorite thing is potato heads, I might direct it to direct our client to the potato heads because I know that they like that. And I know in the back of my mind, I've got 6 things that I need to work on today. And so I'm thinking, okay, how could I make that work with the potato heads? Yeah. But maybe that day someone else got all the Peppa Pigs out and they don't want potato heads that day. They want Peppa Pigs. Okay. So now we're going to Peppa Pigs.
Yeah.
So play-based ABA is really led by that child.
What the child is picking and doing.
Whatever they're interested in.
And I think there's a lot of confusion about that because when I hear about people adamantly against ABA, they're generalizing or saying things like it's harmful to all children. It's harmful. And they're not realizing the child-led side.
Yeah.
And even how you're shaping the behavior looks different.
It's completely child-led. It could be because there's another child in the clinic that day that I know that they play really well with. So I'll be like, okay, well, they're in the big gym right now and they're on the swings. Okay, let's go in here. Let's try to do the swings. And then me and that child's therapist, like, we're like, okay, we really need to work on being able to ask to join. So we can kind of set that stage like, hey, can you practice saying that even if we use their AAC device? But we're going to kind of contrive a setting with every opportunity that they show interest in to be able to work on all of those targets. But we're leading it on the targets, but the child is leading it on their interest.
Yeah.
So
it's not a forced situation. You're doing it more natural led.
And it's not at a table. It's not for a certain amount of time. It's definitely not on that strict reinforcement schedule because natural reinforcement is the most reinforcing. If he's able to ask the peer who he really wants to play with to play, I don't need to reinforce him.
Yeah.
He's playing now with a friend.
He's doing it.
Yeah.
He's playing with a friend. So for moms listening, it is so amazing watching it. One of my favorite things is hearing our staff at Marshall Pediatric Therapy say, when you walk into our gym or into a room or an area, you can't tell who is who. You can't tell who's the speech therapist, who's the OT, and who's the BCBA, and who's the RBT, and who's whatever the service that you can't tell who's who.
Yeah.
And I love that it's that beautiful.
It's amazing.
And it's what I would want if I have a young child if I had a young child with autism, I would want a program like this that is so beautifully integrated. Because there's been a great divide. There's a lot of, in my field as an occupational therapist, there's a lot of occupational therapists very much against ABA and saying, oh, we're only affirming, we're only, assuming that ABA is not affirming. And it's really heartbreaking and sad. And what I've observed too, as well, for myself, I've not had a severe child with autism who has severe behaviors. I've worked with families that they have those behaviors. And I can't imagine living their life. Like, I can't imagine where everything in your house is locked up. That child's going to eat anything they get their hands on, or they're going to smear unpleasant bodily functions on your items around the house. Like, I can't imagine some of those things. So why would I judge that parent for choosing ABA. Like just the humbleness of realizing not one of us as professionals or not one of us as parents have the secret sauce or the keys to autism. We all have to work together.
Absolutely.
It's a beautiful thing when we all get to work together.
Well, and one of the things that I have found out through my work as a BCBA versus in the school system is the amount of resources there are.
Yeah.
There are so many more resources now that I'm a BCBA that I just didn't know as a teacher. And looking back, I wish I would have been able to refer more people to ABA just for some of those resources. Because we do have families that come in and say that they lock all their doors at night and they're still afraid that their child, if they fall asleep, their child's going to get out of the house or get out of his bed.
Yeah.
And it just terrifies them. Well, the beauty of being able to be a collaborative model is that I can go to an OT and say, hey, what are your recommendations for this? And there are safe sleep beds and cubby beds. There's
that insurance covers, and most Kentucky Medicaid will cover for a child. If you don't know this, your therapist should know this, but you can get safe beds and safe sleep so that the parents can sleep and have a peace of mind and their child's safe and they're not going to hurt themselves or get into something in the night or, because most parents don't want to lock their child in a room.
But they're also afraid to fall asleep.
Exactly.
And I think that people miss that parent training portion of ABA it can be just as important as the therapy that we're giving.
That's right.
So all of my families that come in for ABA also come in for parent training.
Yeah.
And we can talk, how are things going at home? What are your goals? Oh, feeding is an issue.
Yeah.
Okay. Let me get you some resources. Safe sleep is an issue. Okay, let me get you some resources. Let me help you with this. And people don't see that side of ABA too.
Right.
Because ABA comes with parent trainings and parent meetings that can be as frequent as once a week. That's our resource and an outlet for our families to have to just be able to know like what's available for help.
Right.
Because when you get that diagnosis, a lot of our families, they get a physician's order that says, go to ABA.
And they don't know what it is.
Yeah. What kind of ABA do I need? What kind of other services do I need? So that's that kind of added bonus that I feel like people don't talk about as much for ABA, that parent training is just as important.
Yes. And, the other thing that's so different, I think, about some centers are 40 hours only or max amount, and other centers are really individual, what the child needs. I mean, every child is individual, and there are some children that I know we have stories that you've been a part of, some children's journeys that everyone would have said, oh, that child needs 40 hours of ABA. And we've had a less intensive model, and the child did beautifully well and made tremendous progress and was able to transition back into school and back into home life and back into all the things they need to be a part of, and in a relatively short amount of time.
Yeah.
And it's pretty amazing when all the therapies work together. The progress is so much faster when you have a speech therapist and an OT and a PT or a mental health counselor and an ABA team all working together. It's really a beautiful thing.
It really is.
So amazing.
And I think that least restrictive environment that more new ABA is going to where it isn't that immediate, we need 40 hours, and if we make progress, then we'll back off.
Yeah.
It's, okay, well, let's start with 7 hours or 10 hours. Let's see how we do. If we make progress, there's no reason to go to 40 hours.
Yeah.
And kind of the new push in ABA is that we really should start with that least restrictive environment and see if they thrive.
Yeah.
Because, again, we've worked with children that would have been recommended for a 40-hour-a-week program, and she did 11 hours. And in 11 hours, maybe right at 2 years, she was back in school 5 days a week.
Yeah. It's a great thing.
And
I know I've loved hearing our team, the way they partner with school and the way the families and the school and the center all work together, and the way children are able to be in school and still come to
have friends.
Yeah.
I think that was the most important part of that particular child's journey, was the family coming back to me and saying that when they went to like a school function, a little girl came up to the mom and said, "Are you her mom? She's my friend."
Aww.
And how important that is for all moms. We want our kids to have friends. We want our kids to be happy and have someone to play with at school. And, that mom was afraid that wasn't going to happen for her.
Yeah.
And again, she didn't need 40 hours. She needed 11 hours.
That's so
was
great.
able to go to school and make friends.
Are there any other misconceptions you come across that parents have, like the parents that are listening, that may be helpful to them about, because, sometimes I've heard misconceptions like all kids have to do 40 hours of ABA, or, some centers are better than others. There's all kinds of things information parents are navigating.
I don't want to say that some centers are better than others, but the same way that we've all experienced, you had a really, really good teacher and then you had a teacher you weren't so happy with, you didn't gel with.
Right.
The same thing is for ABA, and parents have to have that relationship with the people providing ABA that you kind of want with that good teacher.
Right.
Someone that sees my point of view, that understands my child, that teacher that made the difference. You want that connection with who's providing your ABA, so that they're meeting your needs. They have the same kind of desires. They see things the same way you see it. So it's not so much that I think one is better than the other. It needs to be the right fit. It really has to be that kind of perfect fit of your desires, your goals, your values as a family. And then is that meshing with your behavior analyst and what she sees or he sees as the goals for a child? So I feel like some parents think
that's really good advice. And can they learn more by interviewing or shadowing, or how do they find that fit?
I feel like they should. And, it gets sometimes a little complicated with insurance, but I do feel like parents should be allowed to come in and see the facility, talk to people. They have great Facebook and other social media groups to where people can talk and share experiences, in other moms group. But I always tell people that they should do that. If you're not happy with your BCBA, it's okay to say, I'm not happy and I would like to change something, or, cause sometimes you can have that conversation and then it was just a misunderstanding, and that BCBA can still help you. And sometimes it's nope, I think we need to just try this somewhere else.
And that's true for probably any provider or professional helping your child. There could be misunderstandings, or there could be the not right fit, and you just need to ask for a different
therapist.
Yeah. I think that's good.
I have some parents that have, and I don't know how this started, but I have had parents that have either been told or they've been encouraged that once their child gets an autism diagnosis, that they should never say no to them. And you'd be amazed how many times I get that. Is it okay to tell them no? Is it okay to correct them? And I'm like, yeah. You would correct any child if they were doing something that was wrong
or harmful
or was going to lead to some kind of bad outcome. You can still say no to your child after their diagnosis.
Yeah, that's good. And, there's another misconception is denying reward. Some parents don't like the idea of, denial, so to speak, to shape behavior, but we all grew up with that. I don't know about you, but in my house, if you didn't eat all your healthy food, you didn't get dessert.
Yeah.
If you didn't do your chores, you didn't get to go out to play. If you didn't do your homework, you didn't get to do, playtime. Or even as teenagers, if we didn't have our room clean, we didn't go out.
Yeah, absolutely.
Like there's delayed,
and when
there's consequences for our behavior with typical children.
Absolutely. And I think that is the most common misconception I have with families that come in, because I think they feel like because they have a diagnosis, they have to change everything about the way that they speak and interact with their child. And it is the same thing. My 21-year-old son going to college still lives at home, but if he was failing out of school or getting in trouble, like he wouldn't have a car anymore.
Yeah.
I would no longer be paying his tuition.
Right.
Because those would be the natural consequences for his behavior.
Our parents did a great thing when we went to college. They said, if you get a 2.5 and above, your college is covered. 2.4, you pay 25%. 2.3, you pay 50%. 2.2, you pay 75%. 2.1, you're now paying it all. And, it was clear, laid out. It was good.
And that is a reward.
Yeah.
So when you think of it as ABA, that's a reward system. If I was going to lay it out like that for Davin, I'd be like, your reward is that you don't have to pay next semester's tuition.
Right.
The same thing as when he was little. Again, when he was in middle school, he had to cut the grass. That was his thing. But if he didn't cut the grass, then I wasn't driving him to Boy Scouts. We weren't going on that camping trip. But that's a reward. He earned something and then he got rewarded for it.
Yeah.
And sometimes people think that ABA because it's a reward type system, that it's somehow different. And it really isn't. It's the same kind of function that all human behavior follows.
It is.
If I earn something, I feel really good about myself because I've earned it.
And we do it a lot to babies. We don't even think about it. We tickle them or giggle when something's cute or, whatever. You're rewarding with your behavior back, your feedback back to them.
One of the things that Dr. Hanley said is kind of our new push in ABA, he said that the human entity, we want to earn and yearn, or yearn and earn. Yearn and earn. And he says that that's an intrinsic value every human has.
Yeah.
Like we think about like little kids that run up and want to show you the picture that they drew. They're vying for your reward to say, oh, that was amazing. Good job.
Yeah.
And play-based ABA is that. It kind of got a bad name because of that kind of traditional method that was used, again, at a research setting, but it's kind of the same thing. When we do something, when we're playing and we win the game, or we were able to share, we can give them a high five or say, yay, good job, you've earned a token.
Yeah.
But we're all earning something, and that's what we all want. We all want praise. We all do that. So it's not just ABA.
Even adults, we like it in our jobs. We like to be encouraged in our job.
Yeah.
When you're a pediatric therapist, your encouragement is a child meeting a new milestone or gaining a new skill or meeting a goal. And you're like, yes.
Absolutely.
That's what we're working for.
Absolutely. And those moments can, knock your socks off when someone takes their AAC device and goes through and gives you a whole sentence.
Right.
Telling you what they want. And you're like, I'm done. I can go home.
I know.
I've won.
Right. And you go home and that's all you can talk about is the big win.
Yeah.
That happened.
But those are the things that, again, when you talk about misconceptions, I don't think people realize that we're all doing that. We're just targeting skills that children haven't mastered in communication and social and adaptive behaviors. They're missing that skill. So we're rewarding them as they make all those little steps towards achieving those skills.
Yeah. How do you help parents feel comfortable to start ABA? Like parents that you've talked to that are questioning, is this right for my child? What's something that,
Well, one of the main things that I really like about Marshall, because we do provide OT-PT speech, there are parents in our building all the time. They're coming in for a 30-minute speech session, a 60-minute OT session. Maybe they're going to come in for a longer ABA session. And during an eval, when I'm talking to families, I can say, do you see all these parents here? If you're worried, just come in. Yeah. If you can take the time off work, come in. Stay the whole time. This isn't closed off that you're going to drop your baby off to me and I'm going to shut the door and walk away with your child and you're not going to see them for 2 or 3 hours.
Right. You can come.
You can absolutely come into ABA therapy.
Yeah.
And I've often told families, I've often told parents, if you go in and you're wanting to see if it's a good fit and they say, no, you're not allowed, we're going to close the door and then you can come back. You can't see what we're doing. Like that should be a red flag. Don't do that.
Yeah. Yeah. You want to be involved.
Yeah. Yeah. Don't do that.
Yeah.
Like,
yeah,
that's your child.
And then when you know it's a right fit, then maybe you can trust the sessions without you being present.
Yeah.
Yeah. Being present is a good thing.
Yeah. Come watch, come participate in your session.
Yeah.
Because you watching me work on skills, you're going to learn skills just by watching. But you should also feel comfortable and you should trust me. And maybe I made a recommendation that I wanted you to come in 2 or 3 days a week. If you want to start with 1 and just see how it goes, I'm not going to say no to that. I'm going to say, okay, that's fine.
Yeah, start with 1.
Because I know once you come in and you see it, you're going to be like, oh, this is great.
And it makes sense when you see it.
Yeah. When I see it in action and I see all of the children playing, then you're going to be comfortable.
Another fear I've heard is some parents really are afraid, and some of you listening, you might be afraid that your child's personality is going to change or that it'll somehow be different by starting ABA or shaped with ABA. What do you say to parents that have that question?
I've heard that, but it's hard for even to wrap my mind around how that could even possibly happen. Again, I've always been involved in play-based ABA. Yeah. I've seen the more traditional model, but I've always been involved in play-based ABA. So it's one of those things that sometimes I literally say to myself, I do this as a job. Like we're jumping on a trampoline, then we're going to go do puzzles, then we're, going to go sing songs. It is so child-led that it's almost allowing them to express what their personality really is.
Yeah.
Because we're hitting all
So it's actually opposite of the fear that a parent may have that their personality is going to change or somehow go away or be shaped into something different when their personality is going to stick and come through. It's really going to blossom
under or with ABA because so many of our children that come in with a new diagnosis of autism are having communication deficits. So then once we work on communication and we improve it, then they have so much personality. It's almost like they're coming alive. Like, it's like, oh, you spunky little thing. That was funny. And like when they tell a joke for the first time and they're laughing and you get to watch that develop, it really is the absolute opposite. And I guess I've never seen and worked in the other model, so I don't know how that works, but in a play-based model, that I don't see how it could even happen.
Yeah. Well, that's encouraging if you're listening. Tell me about what's different about the collaboration. Like, I know that a lot of ABA programs don't necessarily have the integrated model where all the different types of therapists are working together. So like a speech language pathologist, they have such incredible long-term training on language and understanding that in such a different way than a BCBA is trained. And so to have, because usually language is the thing you need to unlock, or the communication, even before language hits. That's such a big piece to behavior and big piece to a child growing and developing. And I know I've observed, I feel like our kids are going faster, farther because of that interaction between the professionals, between speech and, BCBA and the OT and the PT. All of it's just working together. So what have you observed?
So observing it now in private practice, it almost makes me look back at all of those years that I taught in the classroom going, man, if I would have known this, I would have fought for this in public school.
Yeah.
Because it is so different. Yes, our kids went to speech when I was teaching, but it was pull out.
Yeah. Just go up the hall, go to the hall,
go to the speech teacher. But now what I really love about integrating, especially speech, because as a BCBA, we have to address communication, but we get just the tip of the iceberg in our course of study, just the very tip of the iceberg. Mm-hmm. But now I get to watch them do it. And I'm like, oh, wow, that's cool. Show me that again. Mm-hmm. And I can learn, and they might see that client once a week. Well, I might have them 2 or 3 days that week. Well, now that I've watched their speech pathologist either do a skill with their AAC device or help them articulate a word, the next 2 days when they're with me, until they're going to see their speech pathologist again, I can be like, oh, okay, now remember, we're going to try it this way. This is how we're going to do it. And now I can practice
and reinforce.
I can practice. I can reinforce. Just a different way to think of things. Then we don't have that type of background. I remember an OT one time, and again, I know you're an OT, but this blew my mind. She was like, well, if you do orbital swinging versus linear swinging. And I was like, what?
Yeah.
I don't even know.
Because linear swinging is calming. And if you go round and round, you're going to wire that kid up.
I was like, what?
Yeah.
And she was like, no, do it this for this and this for this. And I was like,
oh,
well, there you go.
Yeah. Is understanding the sensory input and what it actually does to the neurons in the brain and how it, and it's a great thing to learn that.
It's one of those things that once you explain it, I'm like, oh yeah, that makes perfect sense. Never thought of that.
Yeah.
But then now, again, they see their OT maybe once a week, maybe if they're lucky, twice a week. In those interim times when they're not with their OT, I can be like, oh, but they told me to do it this way. And now I can follow through and reinforce. It makes OT and speech or PT or whatever, it's so much more effective.
Yeah, it does.
Because we always talk about being able to send things home with parents to practice, which is all fine and good until you have a soccer game and you have to make dinner and do homework. And
you have real life happening.
You don't have time to do that at home, but I do. Mm-hmm. I can come in and say, no, this is what we're practicing. We got to make sure we do it this way. This is what we're really working on. With PT, we're going to climb using one foot in front of the, alternating legs. Yes. Mm-hmm. Again, not an OT, PT, speech, but man, their addition to my therapy it's a game changer. Yeah. Especially when it's not just them telling you about it. They get to come into the session. You get to watch them.
And motor skills, coordination, crossing midline, all those things are part of learning. They impact how a child learns and how a child develops in the classroom or with their skills. So it does. It impacts everything.
Yeah. And we don't get any of that knowledge as BCBAs. That's all very specific knowledge to those fields. So being able to see it, I want to say it was like a game changer, but it really was one of those things that I kept saying, man, if I would have known that, I would have referred that kid at school and said, school-based speech wasn't enough. You needed you needed to go and get like kind of the medical model of speech, not just the school model of speech or the, school OT versus a clinic-based OT.
Right. Having both is a different perspective for
a totally
each.
different perspective, but it makes a huge difference. Yeah. Again, it's a whole team working together, wrapping it around. But for me as the BCBA, I can take those skills when you're not with them because I got to watch you do it and I can practice.
Yeah. Well, one thing I love and appreciate about you and really all of our BCBAs, but especially you, because you're the first that I think really vocalized it to me, is just how you understand, like you're humble, you understand that you need OT and speech and PT and mental health. You want the expertise that they have. And, I think this is maybe why as a profession, as an OT profession, there's been some OTs that have been told by BCBAs, oh, we do what you do. You're not important. That sort of attitude or whatever. And really, I love your humility and how you're able to come in and value and